When I get it, I will tell you. All right? Let's see what's going on. Hello, everybody. I see that people coming on Facebook. Soon bring up my face. As you come on, just share. We're getting ready to start. Unfortunately, no Instagram today because my son has some schoolwork. My son has some schoolwork to do on his phone. Hi, everybody. Come on and share it, please. Don't leave. Come on and share it. Just come on and share the link. Come on and share the link. Today we have a lot of things to discuss, so just come on and share the link. It look like I'm leaving because I can't see my face. Hi, you can hear me? Yes, you can. All right, I'm not seeing the comments as yet. As I said, I'm not going live on Instagram today. I'm just on YouTube and Facebook. Excuse my disheveled appearance. I don't start get ready yet. I have to go to work. Morning, everybody. I'm drinking my tea, dandelion, and coconut milk. I used to drink coffee. I used to be a coffee drinker, and I basically weaned myself from coffee. And I found that dandelion tastes just like coffee. I used to like coffee with coconut milk, and so I started having dandelion with coconut milk, which is a healthier alternative. So I will be sipping on my tea from time to time. So as we see, the discussion today is going to be on Nsaids. We've been hearing a lot about Nsaids in the media. Okay, hi Henderson. I'm not seeing all the comments as yet. I'm not seeing any comments over on YouTube. I don't know if the YouTube people, the YouTube massive don't realize I'm live yet, but me know say them soon come. I know that they'll soon be up and running. All right. Yeah, there's one person on YouTube. Hi to the person on YouTube. I don't know who is watching me, but yeah, so I only see, okay, I see some things start popping up on Facebook now. Hi, Venita, Peace Waby, and Janet. Hi, Janet. I haven't heard from you in a while. Unruly, aspirin is also NSAID. It's classified as an NSAID. We're going to talk about that as well, unruly coolie. All right? Venita, Swaby, morning. Brian, Barbara, everybody, morning, everybody. All right? So as I said, if you're just joining me, the discussion today on COVID Talks Daily, COVID-19 Talks Daily is going to be the safety of taking Nsaids while having COVID-19. Now, before I do that, I just want to show you this. I cannot stress the importance of social distancing. Good morning, Marcia. I cannot stress the importance of social distancing. All right? As the great Dr. John Campbell says, and that's his hand that you're seeing holding up his sign. He did his video on this morning. 2 meters distance determines our existence. Good morning, Lisa. You are the first person I'm seeing over there on YouTube. Good morning, my darling. 2 meters distance determines our existence. Try and remember this, all right? We cannot stress social distancing enough. We cannot stress social distancing enough. So let's go to the coronavirus update. You know, it's galloping. This thing is galloping. You see that we now have 395,000 cases worldwide, steadily galloping to 500,000 people who would have been affected by this in some way or another. 17,000 deaths worldwide. The recovery rate is still some way behind. But I want you to look at yesterday's figures. 3:51 at the same time yesterday. Yesterday we discussed this during Monday morning meds. We were at 3:51. Today we are at 3:95. So we said that overnight we added on basically 40,000 cases and 2,000 more deaths. You understand? So 2,000 people died in 24 hours from COVID-19. You understand? So this is not something for a joke. We see where a 13-year-old girl has died in one of those South American countries. I soon tell you is where. It slipped my mind. I have it on my page, but children are not immune. We see also a 12-year-old girl in US is now in ICU because of it. We're seeing everybody dying. Good morning, Mrs. Kim. We're seeing people dying all over. Of note, Jamaica, we are up by 2 cases, right? Now, the Prime Minister said some things yesterday that should basically alert all of us. It should really alert all of us. So, in Jamaica, we now have 21 confirmed cases. 14 of those cases have been imported. We have 6 cases that are local transmission, meaning that these 6 people were among the 14 imported people, and they caught it from them. What is puzzling is this one case under investigation. There is this. All right, so Shanafi is saying that there is a 12-year-old girl in intensive care in Sweden. Shanafi is in Sweden, and the authorities are telling us they are going to start testing resistance in the population. Really? Interesting. But this one case is a woman in Portland who had no travel history, no history of contact. They are basically investigating her. Depending on where this investigation leads, we will know if there is community-acquired transmission. And this is the last phase. Now, once community-acquired transmission has been established, the numbers are going to start going up exponentially. And the Prime Minister has basically put us on warning from this already. So listen, we are right on the cusp of community transmission. We need to prepare ourselves for this. All right? The 2 new cases yesterday, one was in imported case from Mandeville, another imported case from Westmoreland. All right? So, of course, there are more enhanced containment measures announced by the Prime Minister yesterday. All persons over 75 years old must stay home. Right? And it's subject to exemptions. And this will take effect tomorrow, Wednesday, the 25th of March. Right? Today, boys and girls champs was supposed to start. All right? They will be allowed to conduct essential activities within certain restrictions. Also, all public sector workers 65 years and older are to work from home, subject to some exemptions as well. Mrs. KM is saying she is not clear why the PM has not advised about persons with chronic illnesses. The focus is more on age. I can answer that question for you. Is it that age is more an indicator of mortality than comorbidities? Yes, it is. The number one determinant of the death rate in terms of the number one comorbidity really is age. They find that the 75, he's spot on actually. And I'm sorry I intended to, but I forgot to bring up the figures. And probably tomorrow we can discuss it, Mrs. KM. Age. But right now, age more than any other risk factor is basically based on what the figures I've seen coming out of Japan and Italy. 1% of the 1% death rate below 60, right? There's a 1% death rate for people below 60. So with all the other numbers, everybody else who died, 99% of the deaths are above 60. And 60 to 69 is only about 4%. All right? But I'm going to break down those numbers for you. Probably tomorrow we can look at age. All right? But today we want to talk about thrombocytopenia, and it's a big word, but it's quite simple. Low platelet counts. A lot of Jamaicans did not know what blood platelets were before the dengue epidemic. Because of dengue fever, every Jamaican know what blood platelets are. Most Jamaicans do not call it blood platelets, however, they call it pallets. It's not pallets, it's platelets. All right? So whenever you hear Jamaicans talking about pallets, they will simply mean platelets. And a lot of us became aware of blood platelets with the dengue epidemic, the outbreak recently, where a lot of children were dying because their platelet function just disintegrated. All right? So, why we're talking about this? Because of Nsaids. Now, a lot of you would have seen my viral video from 2018. From 2018, I did a video on why you should not take cataflam. That video is still on my page. It's all over. Why you should not take cataflam if you believe you have dengue. Once you have a fever or anything. All of this is going to tie in. All right? So thrombocytopenia is just a big word for reduction in platelet count. It's a condition where you have low platelet counts. The platelets are, the scientific name for the platelets are the thrombocytes, and those are the blood cells that help the blood to clot. They stop the bleeding every time you get a cut and your blood clot. It's because the platelets form a plug to basically plug the injuries. All right? So that is what thrombocytes are, the blood platelets. So when you have thrombocytopenia, you have a reduction in the blood platelet count. And the normal blood platelet count is between 150,000 to 400,000 mg/dl. All right? I don't, basically that's the measurement. mg/dl squared, but it's 150,000 to 400,000. In dengue fever, for instance, my son's blood platelets dropped to 18,000, which, of course, if the normal is 150,000, it's way, way below. You have people who were in, if you remember Malik from the whole dengue thing, remember that his blood platelets actually fell all the way down to 6,000, right? So, yes. So why is it that we need to talk about this? Well, the World Health, the French authorities, you know that COVID-19 is taking over. Kamala, please tell your viewers not to start investing in chloroquine phosphate. It's active ingredient in malaria meds, but it's deadly on its own. Africans are rushing for it. Well, it's prescription only here, you know, and really and truly they have no access to it. We have no access to it because it's prescription only. And I think it's so weird that these people hear about a drug that may be used. They don't know how to take it, they don't know how to titrate it, and they just go and self-medicate. They don't know the dosage, right? Chloroquine is a drug that in many, many cases is taken once per week. For malaria especially, it's a once weekly drug. So I can't understand why people are going to go and take a drug, self-medicate with a drug that they know absolutely nothing about, and then they get surprised when they overdose and die. It's common sense. How do you take something and you don't know how to take it? You know, this COVID-19 infection has been proving to me that really and truly the people of the world, it's not just Jamaica, we have a problem with people without sense, in it. It's all over the world. Why would you go and self-medicate with a drug that you know absolutely nothing about? It just don't make no sense to me. It just don't make no sense to me. Anyway, I see Marcia had said something. Marcia, I ride my bicycle to work and all around town. All of a sudden, I start having pain in my knees. Haven't been to any doctor yet, but what you think is happening? I'm not sure. You could probably have, if you have arthritic knees, you probably aggravated it. The best thing to do, Marcia, is to go to the doctor and let them check, because I can't really check your knee over. It could be anything, right? It could be overuse. We have a lot of overuse injuries as well that are not quite arthritis, but because you're doing the same activity over and over. Anyway, not to digress, but yes, Shanafi, it's beyond me why people would self-medicate with a drug like chloroquine. That is a drug where doctor alone is supposed to prescribe, all right? Okay, so as we were saying, The French authorities recently stated that no NSAID, no ibuprofen, no diclofenac, no aspirin, none of these drugs should be used during COVID-19 because they found in their population that it exacerbated the symptoms, it made the outcomes worse. All right. Any of you who were on yesterday and heard me talking to Shay Townsend, who is a Jamaican in Italy who currently has COVID-19, he would have also heard him saying that he had to stop taking Motrin and he had to stop taking all ibuprofen, all of these things, because it made him worse. All right? You can, if you didn't hear that interview, you can always go back on it. It's still on my page. Yesterday's Monday Morning Meds. Our guest was Shay Townsend, who is a Jamaican in Italy who is getting over COVID-19, and his story is very, very wow. But what I'm trying to say is anecdotal evidence so far, meaning on the ground, we are hearing that Nsaids exacerbate the symptoms of COVID-19. All right, so let's go on. Thrombocytopenia is a known complication in many, many viral infections. I already mentioned dengue to you. It's a recognized complication in dengue, Ebola, Epstein-Barr, varicella, cytomegalovirus, rubella, as German measles, as you know, hepatitis A, B, or C, but it is most typically associated with vaguely defined viral upper respiratory tract infections like the flu or gastroenteritis. So what this is saying is that low blood platelet counts are basically is associated with many, many, many viruses. So of course we don't expect COVID-19 to be any different because COVID-19 is in fact a virus, and many of these nondescript viral infections do cause the platelets to reduce. All right. So when the WHO came out and warned doctors about prescribing especially ibuprofen and other NSAIDs, this was expected. What puzzled me is when they actually, a couple days later, reversed that. After, of course, some cry out from the drug makers and manufacturers and some of the doctors them in the USA, of course, where they love NSAIDs and a lot of them are produced. The bottom line is, this is something that you will have to decide because you are the one who is sick. And if you get sick, it is your duty to find out what it is that they have you on once you're conscious enough, because if you end up in ICU, God knows you're not going to know. Good morning, Hannah. Yes, I heard the interview yesterday. Hi, Angela. How are you? Very interesting and informative. Yes, and Shay did say that his Italian doctors had started him on ibuprofen, and they called him and told him to discontinue taking it immediately, something he had already decided to do because he realized it made him feel worse. The MOH also raised a good point. The symptoms of COVID and dengue are similar, and so the persons may have dengue, and we exactly. And let me tell you something, if you take NSAIDs, if you have dengue, that is fatal. That is fatal right there, because remember, a lot of children who had dengue were misdiagnosed by their primary care physicians who did not know there was a dengue outbreak. They were given cataflam or another type of NSAID. Most of them were given cataflam, and a lot of them died. All right? So, therefore, it's better to be safe than sorry. COVID-19, and I'm going to show you the studies, does cause, in the studies that are out so far, does cause thrombocytopenia. All right? Now, drug-induced thrombocytopenia. So it's not just NSAIDs that cause it, you know. You have other drugs that cause it as well. So as I say, any disorder where there are not enough platelets, the platelets clot the blood, so when the blood is not clotting enough, and you can know this through like when you have these hemorrhagic fever type diseases, like Ebola is a hemorrhagic fever, for instance, that's because of the reduction in platelets. Dengue hemorrhagic fever, the same thing. anything that causes hemorrhage, any of these pathogens that lead to hemorrhagic fever is because they reduce your blood platelets. They attack your blood platelets. So furosemide, which is a drug that is used in some hypertensives, gold, yes, people do use gold to treat arthritis. Some penicillins, quinidine and quinine, ranitidine, which you may know as Zantac, some sulfonamides, and statins. Statins are used to treat cholesterol issues. All right, so some of these may also cause. So all these drugs you need to know in case you end up with any illness that causes thrombocytopenia or low platelet count. All right. So what are they saying about? What are the studies saying about COVID-19 and thrombocytopenia? This is a meta-analysis that was actually printed. All right. It's basically a meta-analysis. Is a study that combines many studies. All right. And basically this one was done to establish if there was thrombocytopenia in patients with COVID-19. All right. So because basically the background, if you read the abstract, COVID-19 is a novel infectious disease with lack of established laboratory markers available to evaluate the illness severity. In this study, we investigate whether platelet count could differentiate between COVID-19 patients with or without severe disease. Additionally, we evaluate if thrombocytopenia is associated with severe COVID-19. So what they did, they combined 9 studies with 1,779 COVID-19 patients in all. 399 of those patients had severe disease, and they were all pulled together in the meta-analysis. All right. So if you look way to the bottom at the conclusions, you will see the conclusion: low platelet count is associated with increased risk of severe disease and mortality in patients with COVID-19. All right. So if you are taking one of these drugs, Nsaids or whatever, especially Nsaids, and it already drops your platelet count, your thrombocyte count, your blood platelet count, you are at increased risk. All right, so if you have COVID-19, just like if you have dengue, you don't want to be taking any drug that is going to reduce your platelet count. Now, I can't tell you what to do. This is something your doctor should be telling you what to do. This is something where you need to basically consult with your physician. However, this is the information that I'm sharing with you. All right. Nadine is saying she's so impressed by my knowledge in the medical industry. I'm a physiotherapist by profession, and I was a drug rep. I was a medical representative for 10 years. And if you don't know, medical representatives are extensively trained in pharmacology. So that's why I have a wide knowledge of pharmacology, because I was a drug rep for 10 years. And then I studied herbs on top of that. But I'm a physiotherapist by profession. All right. So Barbara is saying, remember, it's not only Jamaican act fool when there's a crisis. Listen, this crisis show me say people all over the world act fool. When this thing started, Ashley on the program, Ashley is my friend who is in China. When it started, and I started talking about it, a lot of people came on my post and tell me that I was creating panic and hysteria. But if you look at how these things go, the rate of infection and spread of COVID-19, it was just a matter of time before it took over the whole world. That is common sense. And it just struck me that so many people didn't have any common sense. I think this whole thing was just a wake-up call for me. I realized that a lot of people have no sense. And then I thought it was unique to Jamaicans. And then you look and you see what's happening in Italy, and you look and you see what's happening in UK and USA and all over the world, and you realize, yes, Ashley, I'm glad you are here. And Ashley is reminding us to wear our mask. I personally was telling people, say, don't. Yes, Angela is saying papaya juice to enhance platelet counts again. Yes. And remember, that is what the papaya leaf did. Papaya leaf basically elevated the platelet count, and that's why papaya leaf was so good during the dengue outbreak, because the dengue virus literally attacked and obliterated your blood platelets. Any hemorrhagic fever does that. You understand? But dengue was wicked. Even chickpea, all of those things that can cause hemorrhagic fevers, they do that. But the papaya leaf elevate the platelet. But Ashley is reminding us all to wear masks. Ashley is in China, and in China it was mandatory to wear masks. And even down here they're telling us to leave, don't wear the mask, because if you wear the mask, it basically doesn't protect you. But the thing is, as Ashley explained to me, there are more than one reasons for wearing a mask. Number one, many people do not know if they have this disease. I was watching us, and did I upload it? Did I upload that video? I'm gonna play the video for you as soon as I'm done. The South Korean experience, patient 31. That's her name. That's what they call her in South Korea. Patient 31 was involved in a car accident, right? And she went to the doctor to get checked, right? Because she was involved in a car accident. She had no symptoms, nothing at all. She was fine. And she went to the hospital, and they noticed that she had a slightly elevated temperature. She had a mild fever. They asked her if, okay, so Mrs. KM is saying the mask wearing is confusing. I'm explaining it now, Mrs. KM. So they asked patient 31, should we test you for COVID-19? She said no, she's feeling fine, she's okay. She was just a little battered and bruised up from the car accident, a minor car accident she was involved in. She went home. She went to church the Sunday. She socialized, she did everything. She went to church the following Sunday. 2 Sundays she got church, right? This is South Korea. And then she went, the day before she actually got sick, right? So we passed 2 Sundays now. All right, so you see how long it's taking for her to incubate. The day before she actually got sick, she went to a buffet restaurant. You know what a buffet is, right? Where you lean over the food and you take up the food. They say this is why this thing spreads so fast on the cruise ship, by the way, because of the buffet. People breathing over the food and taking up the food. All right. Anyway, she went to a restaurant, a buffet restaurant, and she had her food. The following day, she got very sick, went to the hospital. They tested her, and she was positive for COVID-19. She did not survive. She did not survive. She died. Not before causing the infection of 60%. She basically is responsible for infecting 60% of everybody who is infected in South Korea from this disease. South Korea's infection rate is about 8,500. This one dege woman, patient 31, infected 6,000 people. 6,000 people. And she did not know she had it. So imagine you don't know you have it, but you have on a mask. This is what Ashley is getting at. Exactly, PG. That's the same video I wanted to show. She is responsible for infecting 60% of the 8,000 people who got this disease in South Korea. So imagine just think of yourself as a patient 31. You don't know if you have it, you wear your mask. Because you are protecting not only yourself, but you're protecting other people. That is how you protect other people if you don't know you have it. Right? Let us say you don't have it. And there is a patient 31 among you. You have on your mask, you don't touch your face. If you go to the buffet, then you put the food in your mouth where she inhaled. But if you are anywhere else and she touches a surface, you touch the surface, you don't put your hand in your face. Because that's how it gets. When you have on the mask, you're protecting yourself from touching your face. And also you are preventing the larger particles from going through. It might not stop some of the smaller particles. I'm going to play the video, Michelle. I'm going to play the video. I think I uploaded it. Let me find that patient 31 video for you. Right now. Just give me a minute. I'm going to play it for you. because I know I did upload it. Yes, I did. Where it gone? Show all. Just give me a minute. I'm looking for the video for you to play it for you, cause it's really scary. When I saw that video, I was like, yeah. Okay.
It's called Patient 31.
Patient 31.
Right. I found the video. I'm gonna play it for you now. Alright, let's minimize it. Get it right here. Website. Oh, I need to put it in a window. Alright, give me a minute. Let me sort this out for you. I'm just trying to play this video for you. Why not showing? Screen. Oh yes, capture this screen. Alright, that not gonna work. Let me just play it so you can hear it.
And this story comes out of South Korea.
Okay.
Patient 31.
Okay.
35-year-old Chinese woman flew into South Korea. All right, she flew into South Korea feeling absolutely fine.
Okay.
On February 6th, she was in a minor car accident in South Korea.
Okay.
She took herself to the hospital and she was fine. No major accidents or bones broken or anything like that. However, she had a slight temperature, and they wanted to test her. She said, no, I'm fine. I'm not sick. I'm fine. I want to go. She left. Okay? She then attends church. She goes to church on February 9th and she goes to church on February 16th.
Okay.
Okay? Right after that, her symptoms started to come. All right? That's a long gap between her feeling fine
Yeah.
and then the symptoms coming.
Yeah.
Doctors advise her to check immediately for the coronavirus. She gets tested and she's got it.
Oh, man.
Just prior to the testing, she went to a hotel and had a buffet lunch.
Oh, my goodness.
Okay? So she's gone to 2 churches
Yep.
and she's now had a buffet lunch at a hotel, which so many people can do,
Yep.
which is just a regular day. 2 days, she gets all the symptoms and they officially make her patient 31 in South Korea.
Right.
Her alone, that one person, patient 31, created approximately 60% of all cases in South Korea.
60%.
60 stem from patient 31.
Who was a 35-year-old woman who said she felt fine
Who was yet
35.
went on with her day.
and went to all the places.
1,200 people were infected who were at the church.
1,200.
Those 2 masses,
1,200.
1,200 got infected, right?
From her.
From her. And then some of them went to a funeral. So infected the people at the funeral. And it was a domino effect.
Well, of course, they all have families, friends.
So out of the total 8,897 infected in South Korea, this patient 31,
Yeah.
unfortunately,
Yeah.
created 5,382 of those.
That just blew my mind.
That is patient 31, and that is the story that we need to understand. So if you're meeting up with your friends at home, 4 or
Wow.
5 of your friends are coming at home, if you were going to the parks, if you were at a beach in JBR today, and you may think, yeah, but I was doing social distancing. How did you get there? You walked, you may have touched a rail, you may have coughed, you may have done something. It takes one person who feels absolutely fine to have it in their system and infect.
Okay, you hear that? That's scary. That is scary. That is scary. All right. So social distancing, we can't stress that enough. And as Ashley is saying, even now in China, when we have no local cases, it is still mandatory for us to wear masks. Yes, China has no local cases, meaning all cases currently in China have been found inside quarantine areas, and those people are coming from outside of China. All right, so China basically is getting what they call a backflow of cases. So they sent it out first, it's now coming back to them. The good thing is that they have it under control, because if you look and see what is happening in Italy, Italy is a nightmare. And the thing about it is that other countries are following. If you look at the update that I posted up, you see that the USA is going to, USA is now at 46,000 cases. China had 81,171 cases in all, right? They had 76 new cases. They said that is backflow, all right? Their death rate is at 3,277. Italy is at 63,927 cases. And they have a total death rate of double China, right? Which is 6,077 deaths overall. USA is at 46,168 cases. They have 500 dead people. You understand? I don't know what is going on in Italy. Italy's death rate seems to be at about 8, according to Shea when I spoke to him yesterday. They have about an 18% death rate. I'm not sure why, but the death rate in Italy is very high. And Spain is now at 39,000 cases with 2,000 deaths. So you see that a lot of these countries over there, like the Western European countries, they have a high death rate. But Germany, on the other hand, is basically the outlier, because they are at 31,000 cases, but they only have 132 deaths. I laugh when I say Germany, because my son plays football, as many of you know, and they were planning a trip to Germany, which had to be over the Easter holidays, which is coming up, which obviously had to be postponed. And I remember the coach said, if you could go to Germany, would you? And I said, yeah, because if this thing catches us in Germany, it's better health care. They have better resources, better everything. And I mean, the chances of you surviving in Germany from it is much, much better than surviving in Jamaica or any other country, because they just have the resources. See them? Me hate when me talk and me write, It's surprising though why Germany's death rate is so low and Italy's death rate is so high, because as I say, if you look at the numbers, you would realize that Germany has a lot of cases, 31,000 cases, but yet they only have 132 deaths. If you look at South Korea is basically the same, and they are considered a success. South Korea is 9,000 cases and 120 deaths, and Germany is 31,000 cases and 132 deaths. You understand? But look at UK galloping. You see UK is at 6,650 in all, right? And 300 and odd deaths. So basically, yes, India is doing very well with it. Yes, you're quite right. I don't think India's population is massive. They're right below China in terms of population. I think China has like 1.4 billion people and India have 1.2 billion or something. They're neck and neck with China in terms of the population in the country. And India has done, I've been talking to this Indian man who, he inboxes me from time to time, but he watches my program. And he said to me that he was in India and he decided to come home. He lives here. He's lived there for quite some time. His family is here. His other half is a Jamaican and they're expecting. So he had to come home. And he said to what them see them going on with India in terms of what they're doing to suppress this thing, and their population is so big and they're so close. I would him say, boy, we have a long way to go here to catch up. You understand? But I think India remembers their experience with the Spanish flu back in 1918 and the toll it took on them. So they've learned a few lessons from then. You understand? So basically, I wanted to show you the list of Nsaids because this is what we were talking about. So these are your Nsaids, and of course, Nsaids stands for non-steroidal anti-inflammatory drugs, right? You have different steroidal anti-inflammatory drugs are the steroids you take, like prednisone and cortisone, and all of those that you take. Dexamethasone, those are steroidal anti-inflammatory drugs. Steroids, you understand? But these now are also anti-inflammatory, but they are non-steroidal anti-inflammatory drugs. And some of the more common ones that we know are aspirin, for instance. We know ibuprofen, which is Motrin and Advil. We also have naproxen, which is also very common, and that is Aleve. We know Aleve, right? But one of the most common ones that is not on this list, and I'm just realizing that it's not on this list, is diclofenac. And diclofenac trades as Voltaren and Cataflam in Jamaica. Cataflam. Doctors love to prescribe Cataflam for fever in Jamaica. They love to prescribe Cataflam for fever, especially for children. All right? So just remember that Cataflam is not something, if you see the prescription, don't just ask the doctor to think twice. You understand? Especially if you're having a fever, because you don't know. We don't know. All right. So, Mrs. KM, I hope I answered your question about the mask wearing. All right, that's it. It's saying, I was hoping we wouldn't get it there because of healthcare, because she's saying, Haiti. Yeah, man, Haiti have it. Haiti have it. Yes, Mrs. KM, aspirin is going to cause a problem because a lot of elderly people take aspirin. They have to take aspirin because it's a catch-22. A lot of them, they take other medication. They have to take aspirin to prevent the blood from clotting and giving them a heart attack, because on the other side now of basically thrombocytopenia is when your blood clots too much, and that can make you have other complications. You understand? So it's a balance that you have to weigh with your general practitioner, your primary healthcare practitioner. That is something you and them have to discuss. Anyway, I'm going way over time. I have a clinic to go do today. It's Tuesday, so you know it's my clinic day. So I'm going to go get myself ready now. I hope that I gave you enough information. Tomorrow we are going to look at the breakdown of the age groups. Let us examine the age group them in terms of the numbers coming out, because we have a lot of data now coming out of China and Italy about the basically the breakdown of the people who have caught the disease. You understand? Just know that the majority of the deaths are in people over 75. That is where the data is coming from. So this is why Mr. Holness, the Prime Minister, has decided to quarantine, to basically tell people over 75 to turn at them yard, because these are the people who are mostly affected. So we're going to discuss that tomorrow. I hope this was informative for you. I'm just sorry that those on Instagram didn't get to join today. All right, so good question. That's it over on YouTube. Is saying Tylenol is what they're telling people to take here at home. Yes, so it's either Tylenol or Panadol in Jamaica. Panadol and Tylenol is the same thing. It's acetaminophen or paracetamol. That's the drug name. And people, acetaminophen and paracetamol is the same thing. I remember going to a pharmacy near my home probably about a month ago or 2 ago, and I remember asking for paracetamol, and the lady said to me that they didn't have any paracetamol. So I said to her, "What do you have?" And she said she has acetaminophen. I said to her, "You know that acetaminophen is paracetamol is the same thing." This lady was a cashier at the cash register, and she was insistent that it's not the same thing. I'm just telling you that paracetamol is the same thing as acetaminophen. All right, just so you know. The trade names for that is Panadol, Cetamol, Tylenol, I think Excedrin too. All of those things are acetaminophen slash paracetamol, just so you know. All right, so thanks for joining me. See you again tomorrow at 10 to 10:30, even though today we're gonna get enough brata. All right, so take care.